All right, welcome everyone. We're called to order at 3. We're going to start out. We have a couple guests that have come to speak. First, let's have Dr. Maria Stahl with the Florida Department of Health. Dr. Stahl.
Thank you, Commissioners, and I did bring Barry Inman, too, if anyone has any questions. He's our epidemiology director, so I think you all know him. He's been around. So to give everyone the current update as of this morning, we now have 285 cases, and that is an increase from 271 yesterday. We have 9 long-term care facilities that either have staff or residents. We have done, not us alone, but all of our community partners, we've done 8,370 tests with a current 3.4% positivity rate. Currently in our hospitals, we have 10 patients in the hospital. We have 8 of them in ICU, 2 in non-ICU, and we have 6 on ventilators. The current testing that's going on in our county right now, and before I came here, I actually looked at neighboring counties, taking Orange County out of the picture because they're a bigger county that has had the federal testing done. We're actually just 300 behind Volusia County and about 2,000 above all the other neighboring counties, and even counties comparable of our size. So that's where we are with that. Currently, we have Omni doing testing in Melbourne and Merritt Island. We have Parish Health doing testing at their Health and Fitness Center in Titusville. We are still doing our drive-through testing. We have Stewart and Health First Physicians doing testing. We have Brevard Health Alliance is going to start next week with their mobile van, and they're going to go out to some areas where clients may not be able to get into facilities to be testing. Emergency Management is currently working with the cities, and I think Palm Bay is ready to start a testing within their city. Our big priority tends to still be long-term care facilities. We still have staff, as I said last time, calling down every 2 days to determine their needs, determine if they have clients that have symptoms. When they have symptoms, we are going in and testing them, and then we are doing a whole facility assessment. And if Barry and his staff feel that ACA needs to be pulled in, we are pulling ACA in too. If it needed to be, there are regional teams that we could pull in conjunction with National Guard to actually evaluate the facilities, but the managers of the facility have to give the okay to that. We do have several long-term care facilities that have done testing on their own for all their residents and all their staff. So the few long-term care facilities that we see higher number of cases, some of it is that, and it's people coming back asymptomatic that are actually testing. So we've seen that happening. Barry can come up and talk a little bit about the contact tracing and what we are actually doing and how that is going. Currently, we have our epidemiology staff. The basic epidemiology staff is 4 people. We have another 3 people that were hired on to help with the hepatitis A outreach that happened right before the coronavirus. And they have since been transferred over to coronavirus. So, and then we have other staff from other departments that are helping. We have 40% of our staff that are at least doing some sort of work with coronavirus right now, whether it's answering the phones, screening at the clinics, assisting with contact tracing. So we have that going. And Barry, I can have you come up and talk a little bit on the contact tracing.
And Barry, for the clerk's benefit, would you mind spelling your last name too?
Yeah, Inman, I-N-M-A-N.
Thank you.
Okay, so far as contact tracing, by the way, thank you for letting me speak for a few minutes here. Contact tracing, please understand this has been going on as long as I can remember, and I've been in this business over 40 years, so it's nothing new. Okay, I know there's things out there that say it's new, but we do it all for many, many, many infectious diseases that are out there. So far as COVID, how this is generally working is, we look at their time when they onsetted their disease, and we look at when they're likely to transmit the disease, and then we see about who they've had close contact with, particularly family members, and of course where they work. Generally, what we are seeing is about a 20 to 30% attack rate among the family members, of course, with that. Our problem has been like at work or such situations like that, somebody has come to work sick, just like we see with the flu in most cases. So that's been basically what we have seen so far as that goes with that. So far as if people may have the perception that, if they went out and went to a grocery store or something like that, well, we don't go into that so much, as we go into those who have direct exposure to that particular patient, and the families are always going to be at the highest risk for that. Workers, depending on what type of work they do, how close they are working together, of course, with that. And then what we do with those people, if they have significant exposure, we tell them to look for any signs and symptoms of the disease. If they have any signs and symptoms of the disease, contact their provider. Also contact us, and then we'll be glad to see about getting them tested. As you know, we're doing a lot of testing through the health department or the other sites that, of course, that Maria has mentioned. We counsel them about hand washing, disinfection, of course, with that, and of course, we tell them to stay at home, not to be going anywhere because they're in contact of somebody that has something that's pretty contagious, and we don't want it transmitted around the community with that. So that's generally our definition. By the way, definitions for contacts can change over time as we learn more about diseases. Okay, because we may find that it might be more infectious, it may become less infectious as we learn more about this disease. And it is, this being such a novel disease, there's a lot still we have to learn about it. Okay. Any questions?
I've got some questions. I don't know whoever wants to field them from FDOH. I've had a lot of folks lobbying my office to reopen the county facilities to the public. I talked to the chief medical officer for one of the hospital groups here, and he suggested that if we were to do that, that it might be prudent to require folks to wear face coverings and then also do temperature checks prior to letting them in the buildings. Obviously, we're still going to encourage the social distancing. Is there anything else that you think would be wise to add to that list in conjunction with reopening to ensure that we keep people as safe and healthy as we can?
Well, the one thing I would say, being an infection control, I'm certified in such, is hand washing. Wash your hands before they come in, the alcohol hand rinse. And by the way, our long-term care facilities are doing that. They check your temperatures, make sure you're wearing PPEs, and of course you use the hand sanitizers, of course, that they have. That might be something want to be added to that also.
I appreciate that.
I would also add the disinfection to just make sure that the facilities, once open, are really cleaned thoroughly.
How frequent a basis do you think is reasonable for that?
Oh, daily, but yeah. And have the hand sanitizers available in all the areas where the public would be.
I appreciate it. Any other questions? Commissioner Smith or Isnardi, do we have you both on the line?
Yes, I'm here.
I'm on.
Do y'all have any questions?
No.
All right, I appreciate y'all coming out. Thanks again.
Thank you.
All right, next we have Mayor Dave Berkman from Indy Atlantic. Welcome, sir.
Thank you. Welcome, Commissioners. Appreciate the opportunity. So,
Oh, hang on one sec, sir. Oh, that's right, yeah. Actually, Mayor, Commissioners Isnardi and Smith, the mayor had passed out an 8.5 by 11 sheet here. I don't know if you just want to maybe read it as well.
I'm going to read it. Absolutely.
Okay, perfect.
Yeah.
I was going to say that way
I'll email the 5 of you after this.
Perfect. That way they have what we have too.
Yep. And
Thank
the
you,
hard
sir.
copies are submitted in.
Thank you.
Okay. Well, thank you for letting me speak here. So I'm going to read this. I'm not actually going to go speak really, and the reason I'm going to read it is it was put together by the 6 municipalities on the beach side. So let me speak for them. We've had multiple conversations this week. We're in agreement on what I put down here and wanted to express our feelings to you folks.
Thank you, sir.
Okay. So I am here speaking on behalf of a coordinated and unified position of the beachside municipalities. I speak with the approval from north to south in the county of Mayor Jim Simmons of Melbourne Beach, myself of Indy Atlantic, Mayor Scott Nickel of Indian Harbor Beach, Mayor Frank Catino of Satellite Beach, Mayor Ben Malik of Cocoa Beach, and Mayor Bob Hoog of Cape Canaveral. So as you discuss, and I think your agenda tonight is discuss the reopening phased approach. So as you discuss this, how to open Brevard County in coordination with the state, we are requesting that the opening of the beach parking lot be not included in the initial phase. All 6 municipalities respectfully request the parking remain closed at this time. Closing the parking has been an excellent deterrent to keep people outside our area with the higher COVID rates from entering Brevard County. During normal times, you see tremendous amount of traffic from the counties, and then the way you closed it worked out fantastic. So there is no way to allow, in no way are we ready to start this again. Why put Brevard and specifically the beachside communities higher at risk unnecessarily? You can argue that people are going to come here and park illegally. That's really an excuse and not a reason to change or make policy. Yes, people are still going to come, but it will be in significantly lower numbers if we keep the parking closed. So yes, people have been cooped up and they're ready to get out. We absolutely see that. We see it down. People have been at the beach already. People getting out. You can see on the roads. It's more on the roads. They're time to get out. We get that. But again, the request is to keep the parking itself closed. The police in our towns are exhausted, and I speak for that it's more than just the 6. It's probably everybody. They're working long shifts. Our police are working 12-hour shifts, and they're not quite ready for the crowds that would come if we opened up in this weekend or even the coming week. So let's do this in a clean and phased approach, but not in phase 1. Give us the time to get the message out clearly, unified message from the county and the towns safely for our first responders. Give us time to prepare for our town's employees. Give us time to prepare our town employees and prepare for the large number of people that are visiting our facilities, the beaches, and the restrooms. If you vote to open a parking in this initial phase, you're really making our Brevard beaches a destination. So right now, Orlando has no destinations. Everything's closed. What destination in Brevard County, Orange County is open right now? Nothing. So if we open up the parking, we basically have said, here's the only destination open in multiple counties. Come visit us. So really what if we do this, a day at the Brevard beaches for the COVID not road to recovery. That's our day on the beach. That's our destination, and we're not ready for that yet. So let's send a unified message from the county and plan to opening in a subsequent phase, but let's do it together, and let's not do it in phase 1, please. So if you guys choose to continue to open, if that's the plan, open early. Hopefully we listen, we could do something together. If we do open this parking early, the municipalities have spoken. Each of the 6 municipalities have made the decision that if the county parking is open now, we will individually issue emergency orders and close our parking. This creates confusion. We'll send the incorrect messages across the county to our neighboring counties. It creates a patchwork of parking across the entire coastline. The Orlando News will be reporting, just like they did when the beaches is open, that the Brevard County beaches are open, parking's open. That really won't be true. You guys have the county beaches is a small percentage of the beaches on the coastline. The majority of the county beachfront parking is owned by the municipalities. They will all be closed. They will remain closed, at least for another week or 2. Please respect the request of the 6 municipalities and let us have a little more time. Opening the parking will create significant problems for us. Folks coming from outside our area, they want to come to our parks, the county and the municipalities. To them, they don't know any different. When you say the beaches are open, it's Brevard County beaches, Melbourne beaches. They don't know in the Atlantic, Indian Harbor, it's the beaches are open. It's not the message we're at. So we want to send. So I'm asking if we do this, do it on a second phase. Let's do it in coordination with the municipalities. And let's just have a better coordination than we did the first time when we open up the beaches or close the beaches. So.
Now, Mayor, let me ask you, in terms of the time frame you're looking at, is there a particular metric that you want to see us reach at the county level before we look at reopening them? Or what is it that would be determinative as far as the cities are concerned that would lead you all to believe that it would be an appropriate time to look at reopening them?
Yeah, it's a hard call, right? You know that it's everything you're looking at. And I'd be curious to see how your plan comes out in your phased approach. I mean, the governor laid out a phase 1. I don't think we should be part of phase 1. Are there metrics set? Not yet. I think, and probably the sheriff will tell you, if you looked at what happened up along the A1A this weekend, people illegally parking going to the beach, those large crowds, I'm told that Cape Canaveral had 1,800 people in a mile. Those crowds came and illegally parked and went to the beach. Imagine the crowds if we were open. So was it great that these crowds were there and parking illegally? No. But can you imagine the amount of people that came from Orange County and outside the county at that point, that if everything was open? In the Atlantic, Satellite Beach, Melbourne Beach, we're just a skip over 192. So the Kissimmee folks come to us. And these guys are much higher, they're much higher infection rates. So is there a metric we have? No. I know we're not ready this week or through the week. If we put something together, maybe it started next weekend, and maybe we have every other lot open, but I would ask that we need at least a week, and I think we need coordination from our town managers and along with the county staff, but certainly not tomorrow or Monday.
Thank you, sir. Commissioner Tabaya?
Thank you, Mr. Chair. You mentioned the 6 municipalities. I consider Melbourne a municipality. It certainly has population
It
on the
does.
coast?
Yes.
So for future reference, there is at least a seventh. Do you know where they stand on this?
I have not spoken to Kathy about that. We had a mayor's call an hour ago, the 16 of us. I had to cut off early to come over here, so I didn't get a chance to have the conversation with her. So, no, I do not.
Okay. Next, I'm looking at the second paragraph here. You said, yes, people will still come, but at significantly lower numbers. Is there any data to back up what closing the parking down will do significantly lower?
So,
Or
it's
is that
hard to
just
have any
a-
data. First pandemic I've been through, hopefully the last. So,
So in other words, there's nothing to back
well,
that up.
I don't think
Okay.
that's a fair statement. So let me try. So if you look at, I'll take my town. I'm not going to speak for the other towns directly because I can't speak. I know we have 4 or 5 paid parking lots. The traffic on our beach has been significantly lower. There is no parking. There are people that have been parking, some of the businesses. Unfortunately, some of those have been towed, some of them are affecting the businesses. But if last weekend and the weekend before, if the parking lots are open, our lots would be full. So if you look at how we're sitting today for the weekends, we're in the dozens, 50 people, nowhere near 6 foot, not a problem, way lower. The conversation I have with the other municipalities is similar, but clearly you don't have metrics. But if your parking is closed and there's limited places to park, has to be lower.
So, yeah, the question though is, the assumption there made would be that the people parking in those lots are visitors and not residents. Is that the assumption you're making?
Some of them. Is it all of them? Certainly not. But many of our communities, people are biking. People that live in my town don't typically drive
And
to the beach.
finally, I'm very concerned about the unemployment rate, the businesses that are struggling right now, the insolvency that is taking place. I assume that that's probably happening, many of the
Happen across the
businesses.
county, right?
Yeah.
You know that.
If it does, assuming people will come, and I just have no data to back that up, so I only have your statement here, but let's assume that is correct here for a minute. Isn't that something that will help many of the businesses that are in your municipality and those of the other 6?
Will packing the beaches help those businesses? Certainly. We know that's the right answer, that they will help the businesses. But you have to make a decision, and you guys are up here elected officials of the county, that are you going to put the county's health at risk? Or potentially, and maybe ask the health folks here, you have all the beaches south of us remain closed. Those counties, those people are coming up. We know from talking to people and looking at the license plates, we know Orange County is much higher. So will it help the businesses if more people come? Without a doubt, right? It has no metrics to prove that either. So, but you have to make that decision on what's the smart approach, right? So is one more week going to change and devastate? I don't know. But I can tell you that having beaches completely packed with folks, you can claim social distance, you could save 5 people max, but it's impossible to go to manage that with the police. Our police have spent their time trying to be on the beaches, prior to last weekend, and they've ignored crime. The crime rates have gone up on the cars being stolen. On the beach side, we've had a little crime spree going on and cars breaking in. So there's a lot more to this. So it's certainly an aspect of it. But, again, I don't have metrics to tell you how much better they do, but I agree, they would certainly do better.
Well, I appreciate your time, and I appreciate the decisions you're making. Certainly, this body has to make one.
Yeah, and we've gone out of our way, and in the other municipalities too, significant efforts on social media to help our businesses. I know I personally, we go out, we know what businesses have the specials to take out, we promote promoting craziness. The other areas are doing the same thing. Does that make up for all their business? No. But we've also, one of the things we had a conversation with today is how do we relax all the rules. So going forward, we put sandwich boards out, we're going to allow potentially people to have tents outside for outdoor dining. So all of the municipalities, I would imagine, are willing to go do whatever they can to help offset the damage that's been done and try and help. But there's no right answer across the board for anything. We know that at this point.
And that's why the cities and the municipalities make their decisions, and the county has to make it.
Yeah, and I'm
The
asking
state
you,
makes it.
and I'm asking us to do it together, right? So we've had a disjointed approach going, looking back. The Orlando News, and we've seen this, our police will tell you the same. The Orlando News, when it talked about the beaches being open or beaches being restricted, county open, those folks don't know that. They just know it's Melbourne. Melbourne Beach isn't Melbourne Beach, the municipality to them. Melbourne Beach is between the causeways. And they just know the beach is open, it's Melbourne, it's Brevard County, and it creates problems. So I'm asking to give us at least another week out of this thing. Don't put it in your first week phase, and let's do this coordinated and get the message out correctly.
I appreciate your time.
Commissioner Pritchett?
Yeah, I don't have a question for you, sir. Thank you. But you can, I'm gonna, yeah.
Done?
Just
Okay.
one thing on that, I would like to ask if we could have Mr. Ivy, Sheriff Ivy,
Yeah,
I'm sorry.
absolutely.
I almost called him Wayne, but Sheriff Ivy come up. But on that, Commissioners, as we're doing this, I want to just throw out an idea. I don't know if Canaveral's
Sure.
in this too, but I've been talking to the guy who does Playa Linda.
Yes, ma'am.
And that's our beach, and they're following us as far as parking, and we haven't had a beach open this whole time either. And I
Right.
have got teenagers that have nothing to do, so our North Brevard people can't even go down there. We can't ride our bike or walk to Cocoa Beach, and we should be able to enjoy it too. We're part of Brevard County. So I want us, as we're thinking about this, I know it'll be a big discussion if you guys would think through that, because I have all of North Brevard right now just waiting for an ability to go enjoy the beaches also. So, but I would love to hear from Sheriff Ivy, if you wouldn't
Absolutely.
mind, sir, and hear what his thoughts are on
I
all
just-
these items too.
Yeah, I just have a quick question for Mayor Berkman. So, we talked a little bit earlier, or you and Commissioner Tobias talked a little bit earlier about whether you have data to support certain assertions that you made. Let me ask you hypothetically, do you have a dog?
2 dogs,
What kind of dogs?
Westies.
Have you ever fed them filet or sirloin?
They don't care. They'll eat beef.
If you put a filet or a sirloin in their bowl, do you think it would disappear?
Without a doubt.
Do you have data to support that?
I do not have data to support that.
I appreciate it. Thank you, sir. Sheriff,
Except for my wife yelling at me for feeding the dogs.
I've had that happen too. Thank you.
Gotta try feeding Junie.
Welcome, sir.
Thank you, sir. First of all, thank you guys for your leadership and everything you're doing for the community. I know you guys have had a busy few weeks, phone calls and conferences and everything else. I'm going to be in, with all due respect, Mayor, I'm going to be in complete opposite stance of that. I believe it's time to open our county parks, open our county parking. I've had a conversation with Canaveral. Their position is they're going to keep their city parking in check for the time being. City of Cocoa Beach, as their city manager has told me, that if we open county parks and county parking, they are going to go to 25% parking to be prepared for it. The only thing that they have asked from me, and I agree with this, to give everybody a time to get back in the swing of things, is to let's do it on Monday in line with the governor's order of opening our county parks and our parking. But my position is that, and Commissioner Tobias, I think you spoke to it a minute ago, not only are our citizens in dire need of going out and doing things, our citizens have been great in response to this. They have done what we've asked them for the most part. They are recognizing the importance of this. They're recognizing that we control our own destiny, and that if we follow the CDC guidelines and we do the things we're supposed to do, we'll continue to not only go through phase 1, but be able to get to phase 2 and eventually out of this. So my position is it's time to open our county parks along the beaches. It's time to open our county parking that we're responsible for. And I think, to your point, Commissioner Tobias, our businesses are out there. They are thirsty for business. They are dying. And by being able to give them the opportunity to meet the governor's standard of 25% internal occupancy and external occupancy to the rate they can, I think we're giving them every chance to breathe and to get employment back on the mark and do the things that's going to help Brevard County get back to normal.
Any questions for the sheriff? Commissioner Pritchett?
I was just waiting for when he was done, because
The thing never moved, so I still technically have 3 minutes.
I'll give you your 3, I promise. Your full 3.
I really like that, because I've been really struggling up in the north area, because I heard the governor real clear yesterday, let's get people outside again. And I love that he threw out to Brevard County that we've
yeah.
done a good job of
Absolutely.
allowing people to have some type of normal. And actually, if you look at Brevard County and what we've been dealing with as far as our county, we're a big county. We're really probably ready for his phase 2, but I'm going to respect him and stay in the phase 1, because I would love to
I
get
agree.
50% capacity in the restaurant. So what I would like to do today, I need to know what you guys want to do, because I'm going to do a policy group meeting tomorrow. I would love to get us exactly with what the governor threw out there and go ahead and get everything we're doing in line with him. and go ahead and whatever we've got that's stronger than his, just reverse it and just do what he's laid out for Phase 1, because Brevard County is definitely ready for the governor's Phase 1. And I think we would get people a little bit more normal again. Sheriff, I'm sure you're seeing this too. You know, we're all working, but we've got domestic abuse up, we have child abuse up, we have things happening to people right now. If we don't get them to some normal, this won't go away for them in 3 months. They're going to live their whole lives having to suffer from things. If we have the ability to take it to this place safely, and we don't.
Yes,
So,
ma'am. You know, I've said from the very beginning, my approach to this has been a three-pronged approach. First and foremost, how quickly can we eradicate this virus from our country, from our world? Secondly, how quickly can we eradicate it without trampling on the rights and freedoms of this great country and of our citizens? And third, how quickly can we get our economic engine back up and booming for not only the strength of our country, but the strength of our community? I think when you look down the road, the tentacles of COVID-19 will not just be those that have been impacted with the virus. It'll be those that have been impacted by losing their jobs, homelessness, those that are now going hungry, and even I think you have to factor in mental health and suicide potentials into that as well. So I think it's time to let's get rolling.
good. So, Commissioner, when y'all are ready, I'm going to support with y'all's consent with what you want to do of going ahead and removing all of the stuff we've put into place that is above and beyond what the governor's done at this time, to pull back all those things we've done. I think they're going to expire.
I think the hotel restriction expires today, does it not?
Today or
Yes.
tomorrow?
It's on the 4th?
Oh, the 4th, pardon me.
Monday. So you guys open for discussion what you want to do? I think we're ready to go ahead and lift all those things, but that's where I'm at, and I just wanted you guys to know so that when we get the consensus of the commission, that's what I'll take to the policy board.
Let me jump in just real
Mr.
quick.
Chair?
Oh, please, Commissioner Smith.
Yeah, I would just like to mention, I understand what Mayor Berkman was saying, and I agree 100% with Sheriff Ivey. What I would suggest, if we decide, we as the county commissioners decide that we're going to open things up starting Monday, that would give the beachside communities 4 or 5 days before that next weekend would occur. But if we ask Don Walker to put out a press release saying that county-only parks will open at whatever time and whatever date, and this may or may not include city parks, so that we put some hesitation in the folks that might be traveling here from another county, and they might just say, well, if not all the parking lots are open, maybe we don't want to go, and let the cities themselves issue their own press releases saying that XYZ city is opening their beach and their parking lots on whatever day. So that way we wouldn't be as unified as perhaps some folks would like, but we're going to open, we the county are going to open, and it will slow down, I think, people coming from out of our area and other counties. And then the cities would have, they would be able to buy some more time to get their ducks in a row. That's just my thought.
And I'll jump in real briefly at this point. There are a few thoughts I have with respect to lifting restrictions over and above those from the EO. One of the restrictions that we have in place that was done administratively was closing the county facilities to the public. I still think that whatever we do needs to be driven by data and by the medical community rather than by lay opinion and people's emotions. Health, I can tell you, Health First, I spoke with their chief medical officer this afternoon, and he was the one that suggested doing the masks and the temp checks at the entryways for, certainly for government facilities. I would say that should include the courthouse. I believe they're doing that anyway when they're slated to resume operations. Is that your understanding, Sheriff?
It is, yes, sir. And we're currently doing, even for our employees, as they come into the precincts, they come into the administrative building, we're doing the temp check and a questionnaire.
Perfect.
Commissioner
Yeah.
Lober, wouldn't Frank decide that for the county, and Sheriff, you would decide that for yours? You guys would just we would allow them to do their own.
I'm happy to do that.
analysis.
I thought maybe it would be good to give them some direction in terms of where we're
I
at with
agree.
it.
So I shouldn't be talking in with you. I'm such a female.
No, that's fine. Don't
but,
worry about it.
Okay.
Yeah, and I mean, Mr. Abate, if you have any questions for any of the commissioners or the commission, I'm happy to entertain them. But My thought is, and I've gotten a lot of requests from people to reopen, I don't want to do a blanket reopen while we still have concerns. If the physicians and the nurse practitioners and the PAs are telling me universally, almost to the last one, you still need to have precautions in place, including face coverings and temp checks. If we do that, I don't think there's a reason to continue having the county facilities closed to the public. Obviously, having the hand sanitizer available, as Dr. Stahl suggested, at the entryways, I think that's good. Making sure we're doing relatively extreme daily disinfection and encouraging people to stay 6 feet apart from one another inside, those are all good things. But I think if we do that, there's no reason to keep the facilities closed.
Commissioners, from a county facility perspective and my obligations to handle how we operate those facilities, we are already working, taking actions. We have a task force of directors that are working on how to open county buildings and how to phase back over time all county operations that were, to whatever degree, held back during the course of what we've been going through. I would suggest to you that there are things that we're doing that no one's even discussed here. For example, we're looking at what the appropriate to try to be in compliance with what the governor is saying, what to do with social distancing, where we have reception areas, where we have counter space where the public interacts with us, where we have office space, where we have employees that are not socially distanced 6 feet. And in the last few days, our facilities department is starting an evaluation, and I've given them the go-ahead to go ahead and get either plexiglass or whatever where it's appropriate. And we would like a little bit of time to be able to do that so we can better protect employees and the public when we're ready to open those facilities. To do things in certain areas, certain charter officers may have a limited number of offices. Different from us, we have dozens and dozens and dozens, if not more than that, facilities and entranceways that we would have to man and use the manpower for to do what we're talking about. So we're trying to address it in other ways as well. And if the board would be willing to give us the latitude, I think consistent right now, I don't know if the board's aware of this, there are 61 counties that their buildings, including to the 61 counties, state facilities, they're closed. They're not open to the public. We're still doing business, but they're closed. We are trying to do everything we reasonably can, and I think the staff is working diligently to try to open it up as quick as we can. If the board would be good with it, I think May 18th would be a target date that we would like to be able to say we can have those kind of items that I've just discussed. We are working very diligently to make sure we have plenty of sanitizer, like Maria was mentioning, at all the facilities. We're trying to do other things with the court system. So, we're going to follow whatever direction the board gets, but I appreciate the opportunity to give us a chance to give you a little bit of input of the things we're trying to do to help move this forward as well. Thank you.
I appreciate it, sir. Totally fair. Commissioner Pritchett?
Could I just add one thing?
Sure.
When I was talking about our precincts and our buildings earlier, that's what we're doing with our employees, because at this time, our precincts and our administrative buildings are pretty much do not have a flow of traffic coming in. So that's what we're doing with our employees as they come inside. And if I could just, I know barbershops are off the table for the governor, but if we could find a place for Frank to get his hair cut. It's
Hang on, I'm going to turn your mic off, Sheriff. Commissioner Pritchett?
Yeah, my thought would be on that you, sir, and you, sir, that you do what you need to do to make a safe environment for your employees on the timing that you need to do those things to get it done. I don't think the government was mandating you guys do anything that would make you uncomfortable. The things that I think we should probably discuss is things that are open, outdoor, public activities. Like I'm ready to open playgrounds back up and those types of things where people are allowed to get outside and enjoy their families. So that's my thinking right now. And I love that the governor's opening up some non-essential businesses with some criteria. And I love that Brevard County has done such a good job to keep infections down. So I think our citizens are just the best.
So I'll jump on. I appreciate it, Sheriff.
Yes, sir. Thank you.
in terms of where I'm at with things. But for Mayor Berkman and at least 6 out of the 7, with the 7th remaining unknown, of the beachside municipalities asking us for a little more time, I personally don't have a problem giving them a few extra days. If they said 3 months or something else that had no basis on a metric or on a particular threshold or anything of that sort, I would balk at that. But I personally don't mind giving them, instead of Monday, till next Friday, if that looks like it's something that would be helpful to them. I'd certainly like to be a good partner to the cities. I think that we could have done better in terms of having uniformity with the cities earlier on in this process, and I think there was a lot of confusion, certainly not just locally here in Brevard, but also out in Central Florida and Orlando, the main part of it, with folks coming in because they didn't understand what was closed and what was open. Obviously, we've dodged a bullet to a large degree here in terms of how things have panned out and what the numbers are. And I say to a large degree, not to downplay anything that's happened to folks that have been impacted by this. I think if you've had a relative die, you might take umbrage at saying we dodged a bullet, because some people didn't dodge the bullet. That said, I think it's important when we look at whatever we're doing to understand why the restrictions, even the restrictions in Tallahassee that were in place. It wasn't to totally prevent anyone from ever getting coronavirus. It was to delay the peak long enough that our hospital systems wouldn't be overwhelmed. The fact is that we're looking at least several months, realistically, until we have a decent vaccine that's available for mass administration. In order to get to that herd immunity of 70, 80+%, where the bulk of people have been exposed and have some level of immunity, assuming that that's the case, which we still don't know, that's going to take a while. So the fact is, I don't think we can keep people locked up for 6 months, regardless of what Tallahassee wants to do. And I certainly respect their concern, but I think that we need to look at trying to work with our partners in the cities as much as we possibly can within reason. That's not to say, again, that whatever the ask is, it's just rubber stamped. And I have no problem reopening the beaches, but my preference would be to give them until next Friday instead of next Monday. Mr. Tabaya?
Thank you, Mr. Chair. And I respected the opinions and the directions the municipalities have made, but they make different decisions with the beaches. For instance, a large percentage of their parking is pay, and Brevard County says we're not going to charge people to come visit our beaches. The municipalities like to make money off of that. So that's a decision they've made. And I appreciate this suggestion they made to us, but this board made a suggestion to the cities concerning parking about 3 or 4 months ago. The county had participated in funding parking structures for the cities. The cities turned around and charged exorbitant rates for parking, $10 or $15 a day. We said that we'd appreciate if those cities would not charge folks, especially residents who covered the cost of that construction in the first place, to continue to charge that. To the best of my knowledge, they received that letter, yet made no changes. So, but that's a decision they made. I respect it. I disagree with it, and it seems like that this just happens to be the other way around this time.
And I respect that as well. And I could be facetious and ask if there's any data that you have to support that paid parking alters the transmission rate of coronavirus, but that wouldn't be productive. The point is, the items that you bring up, I agree, it is something that's potentially of concern on a case-by-case basis, but it's important to distinguish that we're dealing with a pandemic, a relatively unprecedented pandemic, certainly in the lifespan of everyone sitting or standing in this room. I don't think a subjective difference of opinion as to whether to monetize parking is something that we really can analogize to what we're dealing with right now. But that said, certainly the overall point that they're entitled to do what they're entitled to do, I agree with you. I mean, obviously it is what it is. And at the end of the day, the commission will do what the commission does and the cities will do what the city does. But I think in an abundance of trying to be a team player with the cities that we've not always been team players with, it would set a good precedent to show that we're doing more than we're absolutely required to at a dead minimum to work with them. Commissioner Smith or Isnardi, do you all have anything?
Yeah, this is Commissioner Isnardi. I'll just agree that I believe that we need to follow the governor's orders. I think Commissioner Tobias brought up a good point about us not always following suit with other municipalities. However, we also disagree on some of the science, because if you remember right, it was some of those health professionals and many people who profess to be emergency management professionals that said that 8,000 to 10,000 people in Brevard County were going to die from this virus. And we didn't really enact a ton of strict regulations or 24/7 lockdowns that, saved all these people's lives. We are not New York City. We are Brevard County. Our residents are behaving as they should. Most people follow CDC guidelines. The people who are immunocompromised and the people that have concerns, and my own patients that I see in my office, they're self-isolating on their own. So they're making good decisions to protect their health. And I'm not trying to pick on you, Commissioner Lober, but, I have a different idea as a nurse practitioner on whether or not people should wear gloves. And I've watched no less than 2 people at the podium today touch their face while they were at the podium. So if you want to talk about science and talk about evidence-based practice and evidence-based medicine, we're not always going to be on the same page when it comes to that. I can tell you that I have full faith in our residents, and they're begging to be able to go to the beach. And I think that, I think Monday is probably a good target date, and it gives people enough time to be prepared. And again, this is only one issue, but I think that we need to have a little more faith in our residents, because we're all doing the right things. We're all protecting our family. We're protecting the vulnerable as we should. And people, if they need to stay home or they want to stay home or they're worried about transmission, then they have the right to do that. So that's my position on it. I think we need to follow the orders of the governor, be consistent with that, and not put any more burden on our economy or on our residents as far as enjoying the outdoors and frequenting businesses if they need to. They just need to follow CDC guidelines.
And Commissioner, the one thing...
We just have to have a little more faith.
Yeah, the one thing I'll say is I don't disagree we should have faith in our residents and our constituents. Who I don't have faith in are the folks who are coming from out of the area who have very few options that they can exploit in coming over to the Atlantic coast and spending some time at the beach. So it's not the residents that I'm worried will misbehave. It's the folks that are coming here that don't live here, that don't have any other options. So again, I just, I want to make sure.
But we were told, I don't mean to interrupt,
That's
but
fine.
I was talking, we were told this was going to happen before, that all these people were going to come down from New York and then totally infect Brevard County because we refused to close our beaches. Remember? We had certain elected officials from other municipalities hammering us, saying we're making bad decisions. We walked our beaches 3 times a day. We walked our beaches, and we never saw people that weren't abiding by those guidelines. So we can keep saying the worst possible scenario is going to happen, but nothing's happening like was predicted. So again, I'm just going to go off of what's happened so far. And I think, honestly, I think we have to stop punishing residents and punishing the people who want to go back to work. Because I know people that can't pay their bills are waiting on their unemployment because those places are closed. And that's not fair to those people either. That affects our well-being.
Yeah, Commissioner,
that affects their health when they can't feed their family.
Just 2 brief things on that. First, I agree we shouldn't be punishing our residents, but I do think we should be protecting our residents to the degree that we reasonably can. As far as the beaches being non-problematic or being less than crowded, yes, certainly there have been many areas that have been in relative compliance or total compliance, but I've had folks tagging me even on Facebook where they have swarms of people that are walking the beaches. And it just depends where you are in the particular day. I heard this past weekend that the beaches were packed. Now, whether one particular block is packed or not, I don't know. I'm not going and hanging out there. I don't think it's a good place to be at this point in time. But again, I don't think we're that far off. I think we're so close to reaching a consensus in terms of what we're looking to do. The only question is not whether we reopen, it's whether we reopen on a Monday or a Friday the same week. So, with that, I think obviously it seems that having heard from who I've heard from, at this point, there's at least consensus among the commission. So where I am may not matter in the end. But I just want to make sure that folks aren't thinking I'm doing things arbitrarily or just based upon a whim. I mean, there's a reason that I feel the way that I feel, and I respect where you all are, but I think to a large degree that the fact that we aren't New York City there are a few things that have struck me based on the conversations I've had with medical staff as potentially being the factors that largely contribute to our having dodged this thing to a large degree. Obviously, New York City has a tremendous population density, way beyond what we have even in Palm Bay or Melbourne. Our largest city, Palm Bay, I mean, it's a joke in comparison population-wise to New York or any other area that's world-renowned for having a high density of people. The other thing is we have, in addition to that, we did close the biggest tourist attractors in the county. Now, I say we, it's not just us. Kennedy Space Center closed their visitor complex as well. The beaches were disproportionately restricted in that parking was made incredibly inconvenient, depending on where someone was coming from, near impossible. We did that, and the fact of the matter is we've had a good degree of luck as well. I don't think that the fact we had a positivity rate of roughly half of the state average or even a third of what some of our neighbors to the south have had, I don't think that's just coincidental. Now, there may be some factor of luck, some factor of people behaving well here, but there are a lot of things that led to that. I just don't want to take a successful or relatively successful situation in light of how the other counties have done and squander that at the last minute and have ourselves have problems. Whatever we do in the end, and I don't care if it ends up going my way in terms of what I'm suggesting or what's been suggested earlier, I think we need to maintain a degree of flexibility. If the positivity rate jumps, that's going to be a problem that we need to address. You know, people have been going out of their minds as the numbers have increased over time. That hasn't troubled me as much as the positivity rate and the potential for that to increase. Because the fact is, when we test more people, of course we're going to get more positive. I mean, it's a fact of life. It's something that's logical. I don't need data to support that. It's something that's just common sense. But the positivity rate, if that starts ticking up, that means we're doing something wrong or not doing something right. Commissioner Smith?
Thank you. I would like to make a motion that we open the beaches and our parks and our parking next week. I don't care whether it's Monday, Wednesday, or Friday. I think that we need to get the ball rolling. I think that most people are aware of the fact that this pandemic hasn't panned out, not to use that word, but hasn't panned out to be nearly as deadly or as infectious as first broadcast, but it is still something that we need to be careful of. We have to ask our people to be prudent and consider themselves as well as their neighbors' well-being. But I think we can get people back to work and back to playing, and cautiously, of course, but I think we need to do that because we're harming far more people with our economy than we are with this COVID-19 or Chinese virus or Wuhan virus, whatever anybody wants to call it. It's a shame that it happened, but we are where we are, and I think it's time to move on. So I would like to make that motion to get the beaches open and the parks and the parking.
But before you do, Commissioner Smith,
second.
Hang on, because I need some clarity as to the motion because the date for it to become effective was somewhat vague, and then Mr. Abate had a question as well.
I just want to give you one piece of information.
Yes, sir.
It may not be relevant, but if it is, I want to make sure I gave it to you. And that is, you know, the sand renourishment that's going on ends on Wednesday of this coming week. And so they're doing that, the tilling on the beaches, and you've got the contractors working there. So if you wanted to do something that became effective on Thursday, which is nearly the middle of the week, then that project will be out of your way on Wednesday. If that makes any difference to the board, I just want to make sure we shared that information.
And again, Commissioner
Well, it
Smith.
makes a difference to me, and I think it's a good idea. So I would make the motion that we open our beaches, parks, and parking on Thursday. That gives all of our staff plenty of time to get everything in place that needs to be done.
I appreciate that. And then Commissioner Isnardi, your second still stands? Maybe?
Can I jump in?
Yes, please, Commissioner Pritchett.
I said yes. I'm sorry. I don't know what the delay was.
Oh, no, that's okay,
Chair,
Commissioner.
I would like to go ahead and open it up tomorrow, guys. This thing expires because this doesn't only impact that, and we're talking about Canaveral, and Play Linda is not going to open for us until we open these up too. They're trying to get a uniformity with the county of what we're doing. So this doesn't just impact the south end, it impacts the north area too. And here's the problem with this. I'm telling you, you're talking about all this parking and not having the other visitors come, but you're also not allowing District 1 to come visit either, because we can't ride our bikes all the way down there. So District 1 has nowhere to go outside except the river. And then I have people complaining about that, but they're being wonderful up there. We have had no new cases in North Brevard. So I'm just going to ask, I don't know where y'all are going to go on this. Monday morning might be fine also, but I'm kind of in the thinking that maybe we should go ahead and just cut this loose as of tomorrow.
Well,
And
Commissioner,
allow the residents that live in the county go ahead and to start getting outside. This was the governor recommended, get them outside, let them do stuff. Commissioner Isnardi, I think, I know it's dangerous asking, you out in the open like this, your opinion, but I really trust your opinion. I would think it'd be a little bit harder to even get this thing outside than it would be to indoors. Is that correct, ma'am, or am I wrong?
I mean, that's science for you. Yes, definitely, for sure. I mean, there's no doubt that you're more at risk when you're indoors. That's absolutely true. And I don't disagree with your suggestion. Maybe if the beach renourishment is an issue, maybe that area stays closed for, till Thursday or whatever, and maybe we just reopen the rest. Start, consistent with the governor's order. I would be in support of that.
hang on, here's the concern, right?
If that's-
And I'm willing to do that.
Yeah, because right now what we have, the motion on the floor that's been seconded is to open them on Thursday. And frankly, just to throw it out there, I would support that at this point, to reopen on Thursday. But unless the motion's withdrawn and another motion is proposed, that's the motion that we have.
You can amend his motion too.
Yeah, if you want to amend it,
motion.
you're welcome to amend it or withdraw it and make a new one.
Yeah, I would like to amend the motion and make it tomorrow. And except for the area where the beach renourishment is occurring, and open that on Thursday.
Next Thursday, okay. All right, and then Commissioner Isnardi, does your second stand?
Yes.
All right, Commissioner Tobias?
Thank you. And it sounds like I'm on board here. I just wanted to ask staff logistically. There's a little bit of work certainly a lot of work that goes on with opening these up, moving barricades, all that stuff. What is the soonest? Is that a possibility to get them open for tomorrow?
Well, are you going to...
Move the barricades myself? Is that?
Well, I was just going to ask, are we going to bring this back to the policy group tomorrow? Yeah. Yes. So we intend to tell staff, I've already told staff, if this happened today, they will start getting ready to do the barricades, to get everything removed, to successfully do that. If they start preparing today and we make the motion tomorrow, then they will have it taken down throughout the up and down the coast by Saturday morning. They'll have it done.
Is that acceptable, Commissioner Smith and Commissioner Isnardi?
Absolutely.
And then they'll be working it tomorrow so that, we should be able to get most of it done. There's some barrels that, may take a little bit longer. That would be what it'd be. But we should have most of it cleared tomorrow.
Right, any further discussion on it? Okay, I'm going to go ahead and call the question. Let's just do a roll call vote since we have a couple on the phone. All right, Commissioner Smith?
Aye.
Commissioner Isnardi?
Aye.
Commissioner Pritchett?
Aye.
Commissioner Tobias? Yes. I was hoping I could vote aye, but I'll be the sole in opposition to this one. I'm voting nay. It passes 4-1. All right, and then as far as the facility issue, we'll leave to Mr. Abate. I'm happy with that as long as he's working on it, which it certainly sounds like he is. What else do you have, Commissioner Pritchett?
Yeah, I would like to go ahead and make a motion that we would go ahead and open back up the playgrounds and the libraries, as the governor's doing in the state also, under the criteria with capacity for libraries. I think they got to do 25%. But that's a used place. I think we're able to do that on Monday, correct? I have a lot of people asking me for the ability to get back into a library.
And let me ask you, because one of the other items that was suggested to me with reference to libraries is to allow people to basically go curbside and pick up books instead of actually going inside. Is that something you might be interested in, or do you really want them to be able to enter?
I think they're doing that already, but I don't know how, oh, here comes the guy.
All right,
I
come on
know
up.
a lot of times, like in our area, we go in the library once in a while, there's hardly ever anybody in it. It's a shame, but it's the truth. So I don't know if we're really having a capacity problem in libraries. But I think as far as, I have children that I'm doing online classes, Commissioner Tobias probably doing the same thing, and I have some students that have no ability to do their homework at home. So this is an important issue for my students, being able to get into a place where they can do their online assignments.
Sorry, making sure Jeff's not texting me at the right time. I'm representing Jeff Thompson. We are already doing, the libraries are already doing curbside pickups. There's several thousand we're doing referencing. They're doing virtual story times on Facebook. They're working for the unemployment library cards. To do, one problem with opening up the libraries, if you're doing library computers, they still have to work on the social distancing. They don't have the final answer on that because, you know, the computers are right next to each other, so they need some time to work on that. On the capacity, I will double check. We'll have to get you back something for the policy group on how the libraries would work on if you want them open at 25% capacity.
Okay, so maybe you guys can work on that and work towards it. And,
Yeah.
okay, because I have some kids are about to fail as of Wednesday.
Yeah.
Mr. Bate?
Yeah, and that will be something, the libraries, that's the board's decision. We don't have to take that back to the policy group, so we will follow the board's direction on that.
Yeah, we'll have the information, yeah. Because honestly, the 25% just came on the governor's. We just saw that this morning, so
And
that's the first time we've gotten any alert on that.
I'll just put out there real briefly before I call Commissioner Tobias. If we can reopen them safely, I'm happy to do that and hopefully get one vote that aligns with everyone else here in this crisis. It would be nice to have at least one where we all agree. As to the playgrounds, I'd be a little more concerned because I don't know about social distancing. So if the motions are severed or you make two separate motions, I'd be inclined to support the one with the libraries, but not the one with the playground. Commissioner Tobias?
Let me throw this out with playground real quick. It's outside, and from the information that's coming in, the UV lighting is killing stuff. And we have a daycare at the church, and they're playing together outside, and these kids just are not getting anything. So I just want to throw that out.
I'm not gonna say that you're wrong. I just haven't done the due diligence with respect to that particular question to feel comfortable supporting it today. But I am comfortable if we can have staff's assurance that there are appropriate safeguards being put in place for the libraries to reopen them. But let's hear from Commissioner Tobias first, if we may.
I want to thank staff on this one, Jeff, specifically with libraries. More than 2,000 folks have taken advantage of the curbside pickup. All the libraries are open from 9 to 5. It's very important that kids get nourished during this time, and I think the libraries have gone far and above that. I know they're in the works right now. There's been quite a few hiccups with the unemployment online system for the state. And I know Jeff is working at some appointments, so individuals will soon have the opportunity to go in there and access that type of feature as they move forward. There's some issues I've been informed with fabrics that they're still trying to work around. So, you know, I'm generally very confident in what staff does. I think the libraries, they've gone above and beyond, and they're working extremely hard and diligent to make sure that the people have access not only to books, but certainly technology. They're able to turn books that aren't on hold around in one day. So, I mean, if the book is at the library, you literally can go to the library and pick it up. It's almost more convenient than actually having to go in. And I've been informed they're disinfecting all of the materials once they, you know, come back. So just absolutely wonderful what they've done. I greatly appreciate it, and I fully support what they're doing, and as their, you know, as a staff decision, and with the playgrounds. I wasn't prepared on this one. I hadn't yet looked at the science. I didn't yet know that, you know, that may be a possibility. I certainly would, I support the idea, and I would support that with the condition, and I'm sure, you know, you meant that, you know, that it meets all CDC guidelines as far as social distancing. I know there's probably many different types of playgrounds out there. I certainly want to provide that access, but as long as we meet the guidelines set up by CDC guidelines, I would support support that if that's the intent, whether it's made singularly or individually. I just wanted to, we have tons of opportunities to extol all the wonderful things that staff does. But very rarely do I take them, and the library system, certainly what I envision that citizens touch the most. I mean, few come into planning and zoning, but the bulk of a lot of our citizens go in and use our libraries, and they've been functioning during this crisis. They continue to function during this crisis, and just looking at their numbers, they have about a third of the folks that are sick or are quarantined. So they're doing this with a third less staff, and it's just, during tough times, they've certainly gone above and beyond. And I certainly want to thank Frank for his leadership and the folks that run our library system.
It's fair. And just real briefly before I call on Commissioner Pritchett, one of the items I may bring back to the commission at some point in the near future here, on 12/27, so December 27th of last year, I emailed Jeff Thompson over at Libraries to ask him if we've previously looked at offering online video streaming for the libraries. There are a couple companies that have worked with some of the other counties throughout the state. I think one of them is Canopy and the other is Hoopla. My thought is if we can get one or both of those available to our card holders so they have something that they're able to do at home without having to show up to check out a movie, it would be all the better to encourage them to essentially do the type of behavior that we're asking them or encouraging them to do. I don't know if he's looked at pricing yet. I know he said he would do it during the new year, which we're obviously well into. But Mr. Bate, if you could check with Jeff and see where he's at with that and see what the numbers are for either or both of them. If they're at all reasonable, I'd probably come back and ask the commission to allocate some money, given that we're trying to keep people in their homes and out of the facilities, even if we're allowing them to come in. If it's not necessary for them to come in, if they can do something at home, I'd rather they do it at home. Commissioner Pritchett.
Yeah, that's a good thought, and I like that also. And Commissioner Tobias, thank you. You threw out something that just dinged in my head when you said that the CDC guidelines. So I probably don't need to make a motion on this. Maybe if we just ask staff that as we're able to do these items under CDC guidelines, that we'd make them available. And I think our libraries are awesome. Also, I think the hitch that I have is I know I have students that have no ability to do computer work, and all my classes moved to online. So I've lost 2 students right now. And I don't think they got finals Wednesday, so I don't think they're going to be able to make it up. But I don't know where they are on the regular school classes, because all those children are doing that. So I think that's a little bit of my heartburn, is if maybe we can set up a facility to open it up for small amounts of young people to go in and to do some computer work, because they don't have them at home. So that would be something, if you guys are good with that, I'll withdraw it. And we'll just leave it on staff to do the best they can to get those things open for the people who need it. Is that
Fair
good?
enough, makes sense.
Okay.
All right, what else have you got, Commissioner? That's easy peasy.
And I'm going to take this to the policy board tomorrow and ask them to enforce what you guys voted on today. Yes? Good?
Please.
Okay.
All right, okay, we'll go to public comments. Do we have any public comments? One.
Oh, no. I have
Oh, is that a
point of clarification. I'm sorry.
Ms. Bentley.
I was just checking with Natural Resources in our office. The beach renourishment area runs from the Mid-Reach and the South Reach, so it is actually the southern boundary of Patrick Air Force Base to and including Spessard-Holland Park. Do you want it to be effective in that distance? That is a large distance. That's why I'm asking.
All right, Commissioner Smith and Isnardi, I think that we had the motion and the second from you all. What are you all thinking?
Yeah, that works for me.
Commissioner Isnardi, are you good with
Yes.
it? Okay. All right, does that work, Ms. Bentley? Perfect. All right, so public comment. Do we have anyone, Mr. Bate?
There is one public comment.
Okay. All right, let's go for it. If you'd start with your name and the city you reside in.
Robert Burns, Sierra. I wanted to touch on 2 things. The first one, Commissioner Isnardi already touched on a little bit, but it was the issue of you wearing gloves on the dais. I think when we're encouraging the public to adhere to the CDC guidelines, I think it's important as leaders in our community that we also exercise those guidelines when out in front of the public in such a public format. Wearing gloves is not part of the CDC guidelines in this context, In fact, data shows that the virus sticks to gloves more so than your hands. So while you've been wearing the gloves in the last few occasions, you've touched your face almost every single time. And by doing that, you're not mitigating your risk, but actually increasing your risk of contracting the virus. So I think it's important as far as messaging that when we communicate to the public that we're practicing the same guidelines that we ask them to follow. The second thing is, and I'm glad the sheriff's there because maybe he can speak on this, but I want to talk about the jail complex and the inmates that reside there. About 2 weeks ago, I was contacted by anonymous staff members, both deputies and civilians of the jail complex on April 17th. One of those individuals was in tears because, and I quote, they fear losing their job, but they also fear losing their life. And at that time, it was relayed to me that the proper precautions were not being taken within the jail complex. We know that since then, 3 deputies have tested positive for the COVID virus. It's the same one that was brought to my attention that were showing signs and symptoms for several days, working without PPE, touching all the same keys, documents, and other stuff, and also had access to the inmates as everyone else. We find it statistically impossible that we have 3 deputies who are tested positive, but no inmates, over 1,000 inmates. There's no inmates that have been tested positive. The question that we can't seem to get answered is there testing being conducted on the inmates? If so, how many inmates have been tested? There are people in there right now that are there because they simply couldn't afford to make their bail, or they're there for some misdemeanor crime. That crime should not equate to a death sentence because the proper guidelines aren't being taken care of, and they're not being taken care of. So these people are scared. Family members need to know that their people are being taken care of. And we've been told the guidelines are being practiced. We know that's not true because the sheriff had 4 parades with inmates chained in chains, not practicing social distancing outdoors. So if they're not practicing it outdoors, we know for sure they can't be practicing it within the facilities of the jail. So we would like to know if the people are being tested and are they being protected, and if there's been any positive inmates that have tested positive for corona. The deputy also stated that they aren't afforded the same PPE as those that are out on the roads, patrolling the roads. They don't feel that safe, and they feel like that their population
Thank you, sir. You're out of time. I appreciate you coming out to comment, though. Thank you.
Thank you.
All right, let's see here. Any further public comment, Mr. Bate?
No, there are not.
Okay. We'll move on into board reports. Mr. Bate?
No report.
Ms. Bentley?
No report.
Commissioner Pritchett? Commissioner Tobias? No report. Commissioner Smith?
No report.
Commissioner Isnardi?
No report.
Did I break the trend? No? Okay. You know what? I'll keep the trend. That's all right. I have nothing that's pressing. No report as well. So I'll go ahead and I'll adjourn it at 4:07. Thank you all so much.
The opinions expressed by any member of the public during any period of public comment do not necessarily reflect the views or opinions of the Board of County Commissioners of Brevard County, Florida, Space Coast Government Television, or the program sponsor, and are solely those of the presenter. The Board of County Commissioners of Brevard County, Florida, Space Coast Government Television, and the program sponsor hereby expressly disclaim any and all responsibility or liability for any defamatory or slanderous statements expressed by any member of the public during any such period.